My name is Albert R. Brown, DPMPA. I am a podiatrist and have been in practice since 1950. I treat all kinds of foot problems: fungus-infected toenails, hammer toes, painful corns, and calluses. For the first 10 years in practiced like everybody else. But it always bothered me because every patient that we operated on went through an awful lot of pain. Little by little, I figured out what we now call minimal invasive surgeries. For example, traditional bunion operations, patients are on crutches for 3 months. With my type of surgery, patients walk out in their regular shoes, drive home, and require no medication.
As a little kid, when he was working all the time, I didn't really know who he was. I just knew that there was this man who lived with us. And then as I grew older, I realized he was a dedicated surgeon, that he cared about patients, and that he freely gave of himself to everybody around him, not only personally, but professionally. And while other surgeons were charging people to come and proctor with them and see how they performed surgery, my father taught surgery for free.
The work that I pioneered is now being done by surgeons in many foreign countries.
When we lost my mother, I wasn't sure he would ever get out of bed again. But 10 minutes after she passed, he was busy diagnosing her hospice nurse, because that's what he does. And he grieved in private in his own way, and he spent the rest of his time trying to help other people. And now at 96 and a half, he still works 6 days a week. I have been trying to get him to work 5 days a week and take an extra day off.
Dr. Brown was recommended to me by friends and relatives and so on and so on. Sincerely speaking, what scared me a little was his experience. When I say experience, add the age to that. But after I came for my first appointment with him, I was really confident because his hands are stable, his head is all there, and he still is passionate about what he does.
The reason I don't retire is because retire from what? When I come in the office, I feel like I'm on vacation. All the patients know me. It's very informal. I don't mind still making some money. Or as I tell the patients, I have to keep working to make money while I'm still young.
And I think his lesson for other people is not just find a hobby, but find something to do that you really find rewarding. And if you do, you'll never feel old, and you'll never feel like a victim. He likes to get up, he likes to tell dirty jokes to patients, the older the better, and he loves what he does, and I should live so long, be so healthy, and be so happy.